Hello, I'm Vincent, and welcome to our dialogue segment of TopActs. You must know that TopActs is a platform initiated by FPA India Nagaland branch, which provides a stage for all performing artists to showcase their talents and hone their skills. And many young people have, through the years, grown on to become influencers in their own genre of arts. We also take the opportunity to educate and nurture young people to responsible citizenship and smooth transition to adulthood with focus on their sexual and reproductive health. And today we bring this special dialogue segment as we observe World Population Day. And with me on call is a young and dynamic person, as in Dr. Nounenuo, MBBS MS obstetrics and gynecologist, junior specialist at NHAK. I must also add that Dr. Noune, when free from her professional duty, loves traveling and exploring new places. Dr. Noune, thank you for giving us your time and welcome to TopActs Dialogue.
Thank you so much for having me here. Yeah, it's indeed a pleasure. I had to be a part of this.
Without further ado, we jump straight into the questions. I have so many questions to ask you today.
Okay, let's get started then.
All right. First question coming up to you. Why do you think the annual World Population Day is significant?
Okay, this World Population Day is significant to create an awareness and find a solution to the growing population issues, with the primary aim to aware people about sexual and reproductive health problems, because this is due to the fact that large number of our people are succumb to poor reproductive health. And this is a celebration of awareness, which tries to get people to know and learn about various population issues. Those population issues including family planning methods, the right to birth, maternal and sexual health, and birth spacing, adopting more small family norms, and use of contraceptive devices. And this day is celebrated to empower both young boys and girls, and educating them right from their young age about reasonable and youth-friendly techniques to avoid unwanted pregnancies at a very early ages. Also educating the general public about and removing them from the gender stereotypes from the society, and also educating generally about sexually transmitted diseases and also ways to prevent them. Also ensuring early access to reproductive healthcare services to every couples. So these are some of the awareness given on this day. And last but not the least, to offer knowledge about sexuality and continuing delaying the marriage until and unless one is able to completely understand the responsibilities that comes along with pregnancy. Yes.
Exactly. What, in your opinion, is the relation between the overpopulation and sustainability?
Okay. When somebody says sustainable in a very simple term is like able to be used without being completely used up or without being completely destroyed. So with the population growth, and the population growth and the resources, they have strong relationship with one another. When we say population growth, is the population growth, it is the number of increase in the number of people living in a particular area. So since population can grow exponentially, though resources depletions can occur very rapidly. And this will lead to a specific environmental concerns, like including global warming, which everybody is facing nowadays, and deforestation and decrease in biodiversity. So, we cannot have a sustainable planet without stabilizing our populations, because we all know that as human populations grow, the human demands for land, water, trees, and energy also grows. So, overpopulations or overcrowding has a negative impact on the environment as well as the economic outcome. Yes.
Exactly. I'm sure all watching this video will understand the dynamics between overpopulation and sustainability. Now, coming on to your comment on awareness and acceptance of contraceptive in Naga society.
I should say, and according as per my experiences working in our society, I feel like there are most of our Naga people, especially those in urban dwellers, they are well aware of the contraceptions available, and they are also well aware of their reproductive health. And yeah, so many of them come to OPD seeking for one, or like seeking for birth spacing methods, or for permanent method. Once they have decided that they have finished or completed the families, they come themselves. But there are other group of populations in our society who are still very unaware of such things, who are still very unaware of the importance of spacings, or who are still lacking the knowledge of contraception, especially in far-flung areas and rural dwellers. No? We still see the incidence of teenage pregnancies in those areas, and then they get pregnant at very young age, and then the spacing in between the subsequent pregnancy also, it's very less. Like they have repeated childbirths, and then most of them suffers from pregnancy related complications. And yeah, during my few years of experience in that society, I feel like there are two groups of populations, like who have the knowledge about contraceptions, and there are also some group of population who doesn't have any knowledge and who are not very aware of these contraceptions in the society.
Exactly, and there are
yes,
so many
I would like to add that.
Sure.
Yeah.
Carry on.
So I would like to add one thing. When you say contraceptions, they are like primary, permanent, and temporary method. What I've seen in Naga society and what I've experienced so far is that we Naga people, especially the male, I'm not saying against them, but the male sterilization and female sterilization also. But in 99% of the cases, who come for permanent method of sterilizations are female. They come for tubal ligations, and none of the male in the family comes for vasectomy, which of course is available, and the services is it's available in both private and public sectors. But what I've seen in our society, the number of non-scalpel vasectomy, we call it NSV, is very less to negligible comparing to other neighboring states. So this is one of the challenges facing in our society.
Definitely, all men must get out of this mindset.
Exactly.
Myths that we have, and I'm also told that NSV is much easier procedure than tubectomy or any other sterilization. Well,
very easy.
Doctor, moving on, what would you do given a chance to promote awareness and acceptance of contraceptive use in our society such as us?
Okay, like given a chance, if I was, I like traveling, and I like, exploring and visiting new places. So I think I will make a team, and then, organize a camp, ligation camp, be it RCH camp, or be it any kind of awareness camp. I would like to, go out there, and then, especially in those far-flung areas who are not very aware of all those issues, organizing camp and then doing ligation camp. I would love to go to and visit those places. Yeah. If I were given a chance to go.
Yes. And that's something that Family Planning Association of India team, we always like to go out whenever we get funds or sponsorships. We are quick to go out, well, partly to see places, and partly to generate awareness as well. And hopefully one day we will be going out together as well.
Hopefully I'll be able to be a part of your team, sir. Yes.
These pandemic times, we want to put some questions on COVID-19 as well. And the first question I've been getting from many people is, can pregnant women get vaccination against COVID-19?
Yes, of course, I should say. As per position statement on recent COVID vaccinations for pregnant and breastfeeding women released that recently, pregnant women and breastfeeding women can safely get the vaccinations during pregnancy. The only vaccinations that is contraindicated in pregnancy is live attenuated vaccines, because there is risk of transmission of disease, be it any kind of diseases, since it's live vaccines. But inactivated vaccines or kill vaccine are very safe in pregnancy. They are not contraindicated in pregnancy. So you see the vaccine that is available globally in the market, or in India, are all inactivated vaccines. So inactivated vaccines that doesn't have any harms, or there is no such risk of transmission of diseases because of the vaccinations. And there is concerns regarding adverse pregnancy events also, but it has been seen, and then some studies have been published, that there is no adverse pregnancy reactions like miscarriages or stillbirth or low birth weight babies or even preterm deliveries. There is no such events that has been published so far. So one can go ahead if you are doubting whether to get vaccinated or not while you are breastfeeding or while you are pregnant. But there is no adverse reaction following, no, I won't say adverse reactions, because some adverse reactions following vaccinations that is seen in general populations like fever, malaise and all. But there is no adverse pregnancy events following vaccinations. And in fact, I feel like every pregnant woman and every breastfeeding woman should be vaccinated now, because their safety is more concerned now. Yeah. So one can go ahead with vaccinations.
Yes, I think that's a very important message that has to go out to our people and to all those people who are watching this video. Well, moving on, can COVID-19 be passed from mother to fetus, a woman to her unborn or newborn baby?
With regard to this vertical transmission of the virus from the mother to the baby, there are emerging evidence. They are now suggesting that vertical transmission is probable. So although the proportion of pregnancies affected and the significance to the newborn baby or the neonate is yet to be determined, but somehow in the third trimester there are like some studies shows that there is chances, especially in the third trimester.
I think
so. Those are some studies, but at present there is no recorded cases of vaginal secretions being positive of the virus, and there is no recorded cases of breast milk being positive for the virus. Yeah.
Then I think that's a very important cue for all the pregnant women to seek, vaccination as soon as possible, so that
yes, that's the importance of vaccination.
So that they are safe and their baby is safe as well.
Yeah.
And you also mentioned breastfeeding does not, or breastfeeding, does breastfeeding transmit the virus?
No, breastfeeding, there is no recorded case of breast milk or breast secretions being positive for COVID virus. So breastfeeding there is no such studies published so far that breastfeeding can transmit the virus. Yes.
Okay, that's good news that breastfeeding does not transmit the virus. No such record as of now. That's very good news. So, doctor, in a COVID-19 situation, what care should be available during pregnancy and at childbirth?
The standard antenatal care during pregnancies and intrapartum care or postpartum care during pregnancies should be the same as during non-COVID era. The standard of care, it should be the same. just in some special considerations, since it's pandemic, extra precautions should be taken, and pregnant mother should this one adopt all those COVID appropriate behaviors like using masks, and then avoid crowded places and all. Yeah, and during pregnancies, during this pandemic, like the number of antenatal visits during or antenatal checkups during pregnancy should be reduced, unless they have some problems, major problems, or unless they are high risk pregnancies. The number of normal antenatal visits should be reduced to avoid overcrowding, or to avoid pregnant women exposure to crowded places and all, because the risk of transmission of diseases is very high, and then the pregnant woman being contacting the virus during pregnancy is very high. So limited exposures, and the pregnant woman should isolate themselves actually. And there should be this one, what do you call that, limited visits in the clinics or in the hospitals so far. Yeah, and then the care during childbirth also, it should be the same, just that the healthcare workers should use adequate protective PPEs, protective suits, childbirth, or even while giving the postnatal care also. Yeah, both the pregnant mother and the healthcare givers now should use protective gears while giving all the intranatal or postnatal cares.
Well, doctor, in that case, would it be advisable to go for cesarean section if a pregnant mother, if a pregnant woman is confirmed COVID-19?
Caesarean sections. When you say caesarean sections, COVID-19 infection is not an indication for caesarean section. Caesarean section should be indicated in those cases only when there is obstetric indications, like when the baby is too big for the mother to deliver, or some cases of placenta previas, or abnormal lies and all. Or else COVID-19 infection is not an indication unless in third trimester, if the mother has severe symptoms, and if the mother have severe maternal distress, to shorten that one, you can do instrumental deliveries. Or else for those patients who are asymptomatic, or who have very mild symptoms, vaginal delivery is much safer than undergoing surgeries, because surgery itself, it has its own complications, and with the disease infected with the disease again, it will slow the rate of recovery, and this one, what do you call that, they have more complications even after birth. So unless there is obstetric indications, vaginal delivery should be encouraged, in COVID-19 infected women.
I think that statement of yours is going to be a huge encouragement to all the pregnant women who are concerned and worried in this pandemic time. Doctor, moving on to my final questions, do you have any comment or advice to our people on contraceptive awareness?
Contraception. Okay. I would like to say that there are baskets of contraceptions, whether be it temporary methods, or be it permanent methods. There are baskets of choices, so one can avail at I won't say at the doorsteps, but one can avail at any private or government institutions. And today is the World Population Day, and then all over India will be celebrating World Population Fortnight. So this fortnight will goes on, and during this fortnight, there will be the services, the family planning services, be it permanent or temporary, will be all available free of cost. So from tomorrow, even NHK, we are going to start all the family planning services completely free to the to those who wants this method. So I feel like everybody should come and avail the services. Yes. And then also See, NHK is being converted to a COVID hospital. So most of the people are doubtful to, come for antenatal checkup or come to avail any kind of services like that. But apart from emergencies, the general obs and gynae, antenatal, and then the OPD services are and emergency services are all available. And since the building is away from the cordon area, um, we are still running the OPD. We are still giving all the services available. So this is my humble request that if anyone is, giving a second thought about coming to the hospitals, you need not, because it's all open like the normal days. Yeah. Though it's been converted to a COVID hospital, the services, gynae services are all available. Yeah.
Yes, true. Yeah, we have so much of fear when there is less information. But thank you for sharing all this information, and I'm sure all the people watching this video will take to note that NHK is open, it is safe, and if you have any medical needs, then you can definitely go. And more so, Obs and Gynae department is, working full time and providing services. Anyone who needs services can go and get these services. Well, Dr. Noune, once again, thank you, and we wish you good luck and our humble prayers for your safety as you serve our people in this pandemic time. Thank you so much for talking to us.
It's a pleasure being a part of it. Yeah, thank you.
Okay, then. Bye, Doctor.